As people, we're just curious about how things work. We want to get closer and more involved to see the inner workings. Welcome to A Look Inside. Join us as we take a closer look at people, places, and things, and what makes them work.
Well, the ambulances these days are mobile intensive care units. So we carry equipment that you would normally find in an emergency room, such as cardiac monitors, IV drugs, all the equipment to do invasive procedures to save lives, whatever aspect that may be. So what you hear here is a Life Pack. It's a Life Pack 15. It does all our shocks for patients who are in cardiac arrest. We have leads. We have pads to shock the victim in cardiac arrest. This is connected for blood pressure. So we have blood pressure. We have a saturation monitor that reads how much oxygen is attached to each red blood cell. And then we also have our leads here that are attached to the patient, so we can read heart rhythms. We can actually take 12 pictures of the heart, 6 horizontal and 6 vertical, to find out if they're actually having a heart attack or some sort of cardiac event. We're able to determine whether they're having an event or not. These are called intubation tools. And this is what we use to save somebody's life when they're not breathing. These are the laryngoscope, and these are blades. They simply connect in together. We put this into the patient's mouth, and we take an ET tube, an endotracheal tube, and pass it through the vocal cords into the lungs. We secure it, and we breathe for them. This is a very, very useful tool in saving lives in cardiac arrest or in respiratory arrest. One that we use very often, twice yesterday, in fact, with good results. So we go all the way from adult to child. What we have in here is our bag that carries even more equipment. This is called an Easy IO. It's an interosseous needle. And what we use this for is if we have a critical patient who's unconscious and unresponsive, doesn't matter if it's an adult or a child, this is a drill. And we actually take the drill, we put the needle on the end, and we drill it into the bone marrow. That way we can give fluid and IV medication straight into the bone marrow. We can take people's temperatures. We can take their blood sugar. We carry tourniquets and a full range of medication in here as well. Dextrose, glucagon for hypoglycemic patients, all kinds of cardiac medication here to save the cardiac arrest victim. All the drugs that paramedics carry these days. There are numerous pharmacological agents that we carry to help any victim in any situation. Alright, so that's what's inside a mobile intensive care ambulance. Paramedic and EMT are the people that make up this ambulance. The ambulance itself, without it being stocked, without all the equipment that you see here, is worth around $130,000. Once you stock the ambulance, you're probably looking at another $80,000 or more, depending on the equipment that you have in here. So it's a very expensive operation. but it's a very needy and a very wanted sort of operation. So the public don't usually see that, but when we go to houses, some of them are very surprised about the kind of equipment that we bring in and the things that we're able to do, because they never knew that they had that resource within the community.